Honorable representatives, colleagues, and friends, thank you so much for joining this ICFP live stage session. I'm Dakshitha Wickremarathne, Senior Technical Lead, Advocacy, Accountability, and Partnerships at the FP 2030 Asia and the Pacific Hub. First of all, I would like to thank our government delegates who are present here today from India and Sindh province of Pakistan for joining this vital conversation, and especially for flying all the way from Asia. I think both of you had flights which spanned over 20 hours. So thank you so much for your commitment and effort to coming to Bogotá to be part of this conversation. Asia is home to roughly 4.8 billion people, 4.8 billion, which is nearly 60% of the world's population. And our region's size and diversity shape both the challenge and the opportunity before us. So today we are going to discuss about closing the gap, addressing the unmet need for family planning in Asia and the Pacific. As you know, despite tremendous progress in contraceptive use, still an estimated 140 million women and girls across Asia and the Pacific have an unmet need for family planning, which means there are women who want to avoid or delay pregnancy, but they lack access to services, methods, information, or an enabling policy environment. That gap is not only a health issue, I think it's a development and a human rights issue. Because of that gap, there are women who lack education, who lack access to economic participation, and the well-being of families and communities. So as FP 2030, we believe that closing that gap requires more than doing programs. It requires a strategic policy pathways centered on government leadership and local ownership. So in this framework, let me introduce first Dr. Indu Grewal, the Additional Commissioner for Family Planning from the Ministry of Health and Family Welfare of Government of India, and also Dr. Talib, Lashari, Technical Advisor for FP 2030 and CIP's Population Welfare Department, Government of Sindh, Pakistan. Thank you so much for joining, Madam and Sir. I'll first look towards Dr. Indu. Dr. Indu, India has made significant progress in expanding access to family planning. Yet there are unmet needs among certain groups, especially looking at adolescents, newly married couples, and marginalized populations. So from a policy implementation point of view, what strategic shifts are most critical now to close this last mile gap and ensure equitable access across all states?
Thank you, Dakshitha. So in Indian context, so first I would like to say that the India's family planning program is one of the most comprehensive and mature program. It started in 1952, then it have gone a lot of changes, many evolutions has happened. So in that sense, I'm saying it is mature and it is very comprehensive now as we see it today. The program is inclusive, catering to all segments of society and all eligible age groups, and we are working on the principle of no one leaving behind. So if I see our data, that knowledge of contraceptives among all married women in the reproductive age group of 15 to 49, so it is 99%, at least one contraceptive. Our unmet need is below 10%. And modern contraceptive prevalence is, MCPR is 56.4%. So if we see all these data, so the focus is not on the achieving any demographic targets. Our focus has totally shifted, driven to the healthy timing and spacing of pregnancies for the well-being of mother and child. So here we are giving information to the couple so that they make informed choices, they make the right choices which is best suited to them. Special emphasis is given to the adolescents and the marginalized group. For them, we have a couple of programs in the ministry. We have Rashtriya Kishore Swasthya Karyakram, which provide age-appropriate information, counseling services on reproductive and sexual health. Then we have Ayushman Bharat School Health and Wellness Program, which cater to the all school children, and as appropriate information is provided them in the schools. Then the other groups which are there, for this we have a special initiative, innovative, I would say, Mission Parivar Vikas, which is focusing only all those population where the unmet need had been high and the special strategies were being designed. A couple who are getting married, then they are contacted by a health worker, and then a kit is given to the all newlywed in which the information about the family planning, and it is given, the counseling helpline number is also there. So at the first contact point, they are contacted so that they plan their family at the right age. So this is what is under Mission Parivar Vikas. Then we have many other information. We have lot of innovations in the IEC throughout the country. We have shifted our focus from the traditional IEC which we had. We have lot many IECs being done now. So at the last, I would say that the country is now well equipped, and we are working on the safeguarding the rights of every individual, and the program is totally voluntary in spirit, comprehensive in nature, and the delivery of service is humane.
Thank you. Thank you, Dr. Indu. I think that's a great example of government taking the charge and looking after its own citizens, especially women and girls. So let me quickly move towards Pakistan now. Dr. Talib Lashari, I think you have been leading the work with the government of Sindh province, but also at a national level. With your experience looking ahead, what specific policy actions or partnerships are proving most effective in the context of Sindh province and Pakistan to address the unmet need gap?
Thank you, Dakshitha. Pakistan is home to 241 million population, even more than that. And the population growth rate is 2.5%, while TFR is 3.6, which is quite high. Pakistan is signatory to FP 2020, FP 2030 commitments. So there has been challenges in the past, but building upon successes of the past, Pakistan government has developed and adopted a policy direction which is based on broad-based consultation, evidence-based, and high-impact practices. The role of FP 2030 Asia Pacific Hub has been pivotal to support and guide the government. Based on that approach, Pakistan in different provinces, especially CIP Sindh, likewise in Punjab, Balochistan, KP, AJK, Gilgit-Baltistan, the different strategies have been devised, and those strategies are based on these consultative process, evidence-based, and high-impact practices. In this regard, a systematic approach has been adopted, and based on that, a CCI recommendations, a policy direction has been set. Under the CCI recommendations, there is a partnership which is called Country Engagement Working Group. This Country Engagement Working Group is a broad-based partnership in which not only federal government, provincial governments, but all the development partners are part of that partnership. Therefore, this partnership is working very well, like PSI, DKT, MSS, Green Star, etc. So, based on this partnership and the CEWG forum, which is having this direction, the Pakistan's indicators have improved a little bit. CPR has gone up from 34 to 39%, and unmet need has gone down to 3% or more. Thank you.
Thank you so much, Dr. Lashari. I think really good examples from both India and Pakistan in terms of how the government is leading the way to address the gap on unmet need for family planning, particularly among the marginalized groups. So I really thank you for being here today. especially at this international conference. This is a critical moment for all of us. So we must move from ambition to concrete policy choices. I think that's our key takeaway from the ICFP. So as FP 2030, we very much look forward to working with the government of India and Pakistan in terms of supporting the implementation of your FP 2030 commitments. Thank you so much.